Now we're going to talk about the topic residents' rights on the CNA state exam. This you have several questions that'll be coming from the topic residents' rights. Know the residents' rights so that you do not violate them. Residents have the right to be free from restraints or abuse. They have the right for their health information to be kept private and confidential. Our residents should receive the Bill of Rights when they're admitted to the facility. Resident Bill of Rights, every licensee of a long-term care home shall ensure that the following rights of the residents are fully respected and promoted. Every resident has the right to be treated with courtesy and respect and in a way that fully recognizes the resident's individuality and respects the resident's dignity. Every resident has the right to be protected from abuse. Every resident has the right not to be neglected by the lessees or staff. Every resident has the right to be properly sheltered, fed, clothed, groomed, and cared for in a manner consistent with his or her needs. Every resident has the right to live in a safe and clean environment. Every resident has the right to exercise the right of a citizen. Every resident has the right to be told who is responsible for and who is providing the resident's direct care. Residents' rights. They have a right to their medical care, privacy and confidentiality, freedom from abuse, and visits from family, and they have the right to engage in activities. You must know ARBA is a federal law. It requires training for CNAs. ARBA was established in 1987. It stands for Omnibus Budget Reconciliation Act. It's a federal law. It has certain standards specifically for long-term care facilities, and it definitely requires training and testing for all nursing assistants. This is must-know information. The ombudsman settles disputes for the resident. What is an ombudsman? This is someone who settles disputes between individuals and, for example, the long-term care facility that resident or individual is living at. If it just so happens to be a dispute between the two, um, the government sends out the ombudsman to help settle the dispute between the two. You need to know that HIPAA is an act created in 1996, and ARPA is a federal law that was created in 1987. HIPAA is the acronym for Health Insurance Portability and Accountability Act of 1996. It mandates industry-wide standards for healthcare information on electronic billing and other processes. It reduces healthcare fraud and abuse. It requires protection and confidential handling of protected health information for residents. HIPAA establishes national standards to protect individuals' medical records and other personal health information. It imposes restrictions on the use, disclosure of personal health information. It gives patients rights over their health information, including rights to examine and obtain a copy of their health records and to request corrections. And the HIPAA privacy rules applies to health plans, healthcare clearinghouses, and those healthcare providers that conduct certain healthcare transactions electronically. Due to HIPAA, you are legally required to keep resident information private and confidential. You can only share the resident's healthcare information on a as needed